With patient care at the heart of every hospital, NHS trusts need to ensure they provide a safe and secure environment. ASSA ABLOY's specification capability and ABLOY's drug management solution help hospitals focus on delivering quality patient care by using digital technology.
It's another busy day at Queen Elizabeth Hospital in Birmingham, where they see nearly 1 million patients a year and run at near 100% capacity. To manage numbers like that, a big part of achieving efficiency is the technology that governs who can go where, the smart doors, designed in as part of a digital construction process called Building Information Modelling, or BIM.
I think the key thing is that it's a new process for everybody, is building information modelling, and it's a journey, and we started that journey early on because we knew that it was important and it's a key success to the future. And I think certainly within the health sector, in the health industry, it will add significant value in helping to minimise the cost. And the sooner we get involved in that process from a design perspective to help the client, help the capital projects teams, then the more we can actually advise and help with in terms of the durability, the whole life costings and the form and function of that build.
ASSA ABLOY's expertise in the hardware and software that controls doors is crucial for the optimum combination of accessibility and security.
The security of a hospital is very important for two reasons. One, in terms of obviously physical protection of both people and of their assets, but also it obviously drives the direction of people within that building. So users that operate within the building will have certain access rights to certain areas. Therefore, by default, it's driving the traffic of the overall population of that building.
ASSA ABLOY believe their approach regarding building information modelling will also help buildings meet government efficiency targets for the next decade. Their input into the design of Birmingham's new dental hospital helped make it economical, efficient and safe.
The doors themselves are obviously a functional part that has to open and close, but we have to understand how the design intent of that building and how those doors need to control the foot flow of people around that building. Time of people moving around the building is fundamental. No one wants to feel that they're walking around a public building like the dental hospital, and they're walking round and round it, and they seem to take forever to get there. But secondly, we've got to think of what happens potentially in an emergency or that type of situation, whether that's a fire or something else, and about how people have got to escape or make their way through those doors, perhaps in a different way to how they'd use it day to day.
Another area identified by the government for major efficiency savings is medicines and drugs cabinets, where security is central. A recent study by one NHS trust showed nurses spend as much as 40 minutes in an 8-hour shift looking for keys to drug cabinets. But ABLOY's Protect 2-click user-friendly remote locking system means that more time can be spent on patients, and its digital usage trail adds an extra element of security. Now every nurse who needs to administer drugs to patients has their own trackable key. Scunthorpe Hospital was the first to put this system to the test.
Since installing Protect 2-click on our ward drug cupboards, we've found that the wards that have it, their drug cupboards are locked all the time. So as Chief Pharmacist, I'm very pleased that medicine security has improved. The nurses also like it because it saves them so much time, and they don't have to go around looking for the keys, and they can then spend that time actually on direct patient care.
And the pharmacy here in Birmingham have found other benefits besides the vital time saved for nurses.
It doesn't take a significant amount of capital resources to install the system. It is the actual lock system itself that you're installing, which is battery operated. So there's no concerns in relation to having new power going to cupboards, and you can retrofit it to cupboards you've got in place. The other aspect which we're extending it to next year will be around patients be able to access their own medicines. So some patients who want to take their own medicines from a cabinet next to them, they'll be given a credit card type swipe, and they can just utilise that to then access the medicines and self-medicate while they're in the hospital.
The system also has the ability to invalidate lost or stolen keys, thereby assuring tight key management at all times.